Tendons and ligaments are soft connective tissues that form part of the skeletal system. The distinction between tendons and ligaments is an anatomic one. Tendons join muscle to bone, whereas ligaments join bone to bone. In terms of their biomechanical, ultrastructural, and matrix compositional properties, however, the two structures are similar, and investigations have revealed an overlap of properties, resulting in a continuum from pure tendon to pure ligament. In connecting muscle to bone, tendons have been considered rather inert, force-transmitting structures that are involved in the movement of joints. While this positioning function is important, certain tendons in cursorial animals have developed another, more specialized role, acting as springs to store energy for efficient locomotion. This is particularly true in the horse, where the tendinous structures on the palmar aspect of the metacarpal region, particularly the superficial digital flexor tendon, or SDFT, and the musculus interosus medius tendon, or suspensory ligament, SL, act to support the hyperextended metacarphalangeal joint during weight bearing, releasing energy when the limb is protracted. Hence, at fast gaits, the horse effectively bounces up and down on springs, similar to a child's pogo stick, thereby decreasing the energy required for high-speed locomotion. As further modifications to this role, the digital flexor tendons have accessory ligaments, AL, which attach the tendon directly to bone, providing a direct bone-to-bone tendinous connection when under full weight bearing, so further reducing the requirement for muscular exertion. It would be expected that these energy-storing tendons have mechanical characteristics suited for this function as a spring, while tendons with a less specialized positional role, for example, human digital flexor tendons and the common digital extensor tendon of the horse, require different characteristics. Indeed, up to a twofold difference in material stiffness has been found between the equine SDFT and CDET, indicating differences in molecular composition and organization. Ligaments also show a degree of specialization. Periarticular ligaments have a similar composition to tendons and other ligaments, but are anatomically more complex. These ligaments have multiple bundles of fascioles that frequently spiral and are taut and relaxed at different joint positions. In addition to their role in providing support for the joint, they also provide proprioceptive information. The fibrous joint capsule is usually closely associated with these periarticular ligaments and function in a similar way. Consequently, fibrous joint capsule could also be considered a ligament. Strain-induced injury of the tendons and ligaments is the most common orthopedic injury in the athletic animal, be they equine or human. Increased risk of certain injuries have been associated with both discipline and competition. For example, in elite event horses, intermediate level and above, there is a significant increased risk of SDFT injuries. In elite show jumpers, grade A and above, there is a significant increased risk of both SDFT and DDFT injuries. In elite, advanced medium and above, and non-elite dressage horses, there is an increased risk of hind limb suspensory injury. Tendons and ligaments can be injured in one or two ways: overstrain or percutaneous penetration and laceration. Overstrain injuries are believed to occur by one of two mechanisms. They can result from a sudden overloading of the structure, which overwhelms its resistive strength. This type of injury is probably the mechanism for most ligament and some deep digital flexor tendon injuries in the horse. However, for the most common strain-induced injuries in the horse, involving the palmar soft tissue structures of the metacarpal region, the clinical injury is believed to be preceded by a phase of degeneration. The evidence for this preceding degeneration is based on 4 observations. Firstly, the identification of asomatic lesions, both grossly and microscopically, in post-mortem studies of normal horses. Care, however, should be made in distinguishing gross central discolorations in otherwise normal tendons from changes which are more likely to represent early clinical injury than the preceding degeneration. Many of these asomatic lesions can now be identified with ultrasonography. Many, if not all, clinical strain-induced tendinopathies are bilateral, with one limb more severely affected than the other. Careful ultrasound examination will reveal changes in the contralateral limb in many cases. In those seemingly unilateral cases, blood flow studies have demonstrated increases in the normal contralateral tendon, which would suggest that it's not totally unaffected. Epidemiological studies have demonstrated close associations between age and exercise and tendon injury. Following on from these observations, experimental investigations have demonstrated evidence of degeneration associated with this synergistic action of both age and exercise. Degeneration is usually the first phase of tendinopathy. This can be likened to molecular inflammation, which does not provoke a repair process, as after clinical injury, but rather progressively weakens the tendon. Any change in the structural properties of the tendon does not have to be great, as the tendon is already operating close to its tolerance limit. Clinical injury occurs when the highest stresses encountered by the tendon overwhelm its structural integrity, resulting in irreversible damage. Once this occurs, the damage created induces a repair process characterized by inflammation followed by fibroplasia, scar tissue formation. This process allows the incorporation of risk factors that have been identified for tendinitis. These risk factors act to increase the peak loads on the superficial digital flexor tendon, thereby increasing the risk of structural disruption. One of the most important factors is the speed of the horse. The faster the horse is going, the greater the risk of tendinitis. Thus, hard going is associated with tendinitis as it increases the speed of the horse and also increases the peak impact loading. Slower surfaces, such as soft going, tend to be protective. Other factors, such as the weight the horse is carrying, fatigue, and the shoeing, can all influence peak tendon loads in this way. Lower heels were thought to be protective in tendinitis, as this conformation tends to increase the load of the deep digital flexor tendon, a secondary supporter of the metacarpophalangeal joint, thereby reducing the support necessary for the superficial digital flexor tendon and suspensory ligament. However, as the highest loading in the DDFT is towards the end of the weight-bearing phase, this may not have an influence on the initial high-level loading of SDFT at the onset of weight-bearing. Once the peak load on the tendon overcomes its structural strength, there's physical disruption to the tendon matrix. This varies in degree from fibril slippage to fibril rupture, and in some cases complete separation of the tendon tissue. This damage initiates a reparative sequence of events not dissimilar to that in other soft tissues such as skin, which is characterized by phases of inflammation, followed by fibroplasia, which results in the replacement of normal tendon tissue with scar. With the formation of abundant scar tissue, the heel tendon becomes strong, but is functionally inferior to normal tendon. As a structure, heel tendon is stiffer than normal tendon, which compromises the tendon function and predisposes to re-injury, often at sites adjacent to the original injury. The initiation of clinical tendinitis is provoked by sudden peak forces that overcome the strength of the degenerated tendon. This can obviously occur at any time, including out at pasture, but it is obviously most likely when the horse is loading its tendon maximally. This occurs when the horse is running fast. Hence, the best horses are potentially more prone to tendon injury. Ground surface, which affects the horse's speed, fatigue after long races or eventing or in unfit horses. Jumping, shoeing, and weight are all examples of factors that can increase the peak loading on the tendon and hence are risk factors for tendon injury. Some of these are avoidable, but others are a consequence of competition, eventing, racing, show jumping, are not easily altered. Early detection is not really a preventative strategy, as by definition, a degree of tendon injury will already have occurred. However, if tendon injury can be detected early, it is possible to prevent progression to more severe disease. Obviously, careful clinical inspection is vital in this area, but this is rather insensitive. One such tool, infrared thermography, has the capabilities for detecting the early onset of clinical lameness, 2 to 3 weeks before being seen by the veterinarian or showing lameness. However, ultrasonography has been the mainstay of tendon imaging and has advanced our knowledge and capabilities for management considerably. Ultrasounds at 3 monthly intervals was shown not to be a sensitive method of predicting tendon injury, although ultrasound is useful to identifying at-risk animals through the detection of pre-existing injury. This may be useful when a horse enters training for athletic activity, since pre-existing injury is the highest risk factor for future injury. Future techniques in this area may rely on molecular markers of tendon injury, fragments of proteins within the tendon which are released with injury can potentially be assigned for in the blood, which can give a practical test and would provide useful diagnostic, management and prognostic information.